Dr. Lana Holmes. How are you today?
Oh, I'm doing great. How are you?
I'm wonderful. Thank you so much for joining us. So, I would love to invite you to introduce yourself, uh, where you are, and the clients that you work with. And then we'll talk about this amazing offering that you're going to be providing for the Touchstone Institute.
Thank you. Yeah, so my full professional name is Dr. Lana Holmes. I hold a Doctor of Psychology, also known as a PsyD in clinical psychology. And I am a member of the Center for Inclusive Therapy and Wellness Practice, which is located in Decatur, Georgia, but it's a completely teletherapy practice with clinicians in several states. And so when it comes to the people I work with adults around depressive disorders, anxiety disorders, trauma and stress related disorders, grief and loss issues, life adjustment and change issues. Also, I work around the intersection between mental health and spirituality. And also, I particularly am passionate about, per the training I'm going to be offering, working with people who are a part of various sexual minority groups. So, whether that be members of the LGBTQIA2S plus community, people in the BDSM and Kink communities, but also people in the ethical non-monogamy community. Yeah, and so it's really awesome, rewarding work doing that. And then also I work with people who are BIPOC as well and issues around that.
So I love the space that you're creating, not only for these issues that what I'm seeing in a lot of the spaces that I occupy is that people are saying like, I'm sorry, what? Like, what is this? What do we need to know? So I'm wondering how your training, as people are coming to your training, this will enhance people's uh, clinical efficacy.
Yeah, and so the training itself is called Kink and Clinical Practice 101, and it's designed as like an introductory course for clinicians, licensed clinicians, also pre-licensed clinicians who are interested in working with people in the BDSM, kink, and leather communities, but are completely green to it. And so there's going to be an emphasis on some like just common need to know baseline topics and definitions, but also things like understanding the psychological functioning of people in these communities and what the research literature says on that. Also, understanding how to best work with people in these populations. And there's also going to be some room for perinatal considerations as well as cultural considerations as well.
Can I ask you, and I know that this is not a full training, but I'm wondering, when clinicians are thinking about cultural considerations,
Mhm.
um, what should they be just kind of like a 45-second overview of like what are things that they should be considering or just questions that they should be asking themselves in working with this population.
Yeah. So I think for me, I think of cultural considerations in two ways. So one way is that BDSM, kink, and other communities are their own subcultures that have their own histories, their own kind of like customs and traditions and ways of like being and interacting. And so I think it's important for clinicians to learn about that history and to learn about culture in that context, but also I think about culture in terms of things like demographic variables, so race, ethnicity, gender identity, sexual orientation, because when we look at the research literature, the BDSM, kink, and other communities are predominantly white communities that are affluent. I would say the one minority group that has had like a consistent and like very clear presence has been members of the LGBTQIA2S plus community. Now, of course, there are BIPOC folks who are in the kink, BSM, and leather communities, but you know, like in so many other areas, they by numbers are underrepresented. And so I think it's important to always include that piece in there of like, okay, well, if I'm dealing with someone who is a racial slash ethnic minority and is also a sub and is also really into breath play, like how do all these different aspects of who this person is impact them in all these areas of their life and when it comes to all of the issues related to their mental health that they need help with.
So I think that what you shared is just so important in the aspects of, we have a lot of people who can be coming into our practices, and they might not have, right? So when I'm thinking about who is um, the people who will benefit from your training,
Mhm,
is that a lot of people don't have the benefit of having therapists who have this knowledge.
mhm,
So I'm wondering, as you're thinking about things that somebody like me, right, like a regular old therapist, can come out of this training having knowledge of that can best benefit their client. What are some of those objectives?
hmm. Yeah, I think some of those objectives is to, well, first, like, have a clear understanding of like what BDSM, kink, and leather are. I know that some people may be like, oh, like that's so like basic. Like, why even focus on that? But I find that like BDSM, leather, and kink are one of those things that have made appearances in pop culture, but still shrouded by a lot of stigma and myths and misunderstanding. And so I think like that's the first thing is for people to have the facts of like this is what this actually is, regardless of what you may have seen in a movie or a television show or like an online, Cosmo article or something of that nature. But I think also I want people to walk away with like being able to understand the history of like, because I think one of the really important reasons why clinicians should be aware of the BDSM, kink, and leather communities and have accurate information about these communities is because there is a history of harm in the mental health field. When we look at the evolution of the DSM, for example, over multiple decades, there was a very large stigma against BDSM, kink, and leather activities and people in these communities where they were pathologized and labeled as having like mental illness, which we know is not true. It's never really been the case, and it's only been within more recent decades and the recent iterations of the DSM that that has been corrected. But still, there are some clinicians that may hold some prejudices or biases that they may not even be aware of, because I think that's the thing. Just because you're not constantly thinking, interacting, working with people in these communities doesn't mean that you haven't absorbed biases. So some common biases that people may have is like, oh, well, if you're into BDSM, liver, kink, excuse me, it must be because um, of child maltreatment or some other traumatic event that you've had in your life, when the research actually shows that there is no correlation between traumatic life events and people being more involved in the BDSM or kink communities. Also, there are folks who may be like, well, if you're into BDSM, kink, or leather, you must like be more prone to developing a mental health diagnosis. And actually, the research literature shows that individuals in the BDSM, kink, and leather communities have psychological functioning that either is on par or exceeds that of their vanilla counterparts. So basically, I want people to come away and also be aware of like their what's called squicks, which is like a portmanteau of squirm and ick, of being aware of like what are the things about particularly BDSM, kink, or leather activities that you may have discomfort around, that you may have ignorance around, that you may have prejudice around. Because I think one of the things that we're all called to when it comes to our ethics code, when it comes to the law, when it comes to our training and professional conduct is to be aware of like the things that we don't know, but also the things that we may have negative attributions about. Because if we're not aware of these things and we don't work on them and we don't educate ourselves around them, then we're at risk of doing harm, which is something we cannot do.
Dr. Holmes, so what I will say, and I'm going to put myself out there, is when I saw you on my schedule, I was just like, oh, kink and poly. I'm sorry, what? Can I do like a Wikipedia, Google search for what this is? But I think that that really speaks to like this huge space of the fact that we owe it to our clients to continuously get educated on things that maybe we don't know about, but we really do need to be educated about. So I love that you're bringing this content to us. And I would ask you to say, What, like, if you had like a top 2 or a top 3 of things that therapists who might not otherwise know this content, what should we know so that we're not causing harm to our clients, so that we are actively engaging our clients and making sure that we are appropriately providing care?
That's a really good question. It's also a big question, right? Because I think for me, like with the way that my brain operates and the way that I operate, I'm just like looking at, so I guess to rewind it, looking at what usually people in the BDSM kink and leather communities need when they're coming into therapy is just someone who's like knows what these communities are and are about so that if people are saying something, they don't have to stop in the middle of session and educate their clinician about, like, well, when I say top or bottom or versatile, or when I say daddy and little girl or anything like that, that like this person is going to be like, what? I'm completely lost. And also, they want to make sure this person is educated enough so that they're not in this place where it's like, ooh, that's really gross and weird and wrong. And I think that like you should stop all of that. So I think people want from these populations want somebody who's knowledgeable and who's going to be able to know this language. So I kind of look at it in that realm of like cultural competence, but also someone who's not going to misattribute someone's mental health concerns to being members of the BDSM, kink, or leather communities. Someone who can basically be affirming in like all aspects of this person's life. Because usually looking at the research base, but also thinking about like anecdotal evidence, people are coming in not because they're like, I have a problem with being a member of the BDSM, kink, or leather community. I need you to get that out of me. They're like, no, I'm a proud member of the BDSM, kink, and leather community, but I also have depression and I want to be able to be my whole self with you. And so, can I do that? Or do I have to hide a part of myself, which is going to just exacerbate my stress and make it harder to fully get the help that I need? So I think it's about making sure that people are aware of like, oh, so this is like everything I need to know about what this person is experiencing when they say that they are a top or a bottom or versatile or a dom or a sub or a switch, or when they say that they're into breath play, or when they say that they're doing a scene. Like, I know what that means rather than being like, what? Can you stop and explain this to me? Or like, ooh, I have a weird reaction to that and I don't feel good about it and that disrupts our treatment or that disrupts our therapeutic alliance. So I think that's one. But there also will be people who come in who are like, hey, I maybe have just discovered this part of myself, right? Like, I'm just coming into the BDSM kink or leather community, and, you know, these are some of the different feelings and thoughts. And again, like, it's not about, oh, well, I think there's something bad or wrong about me. It may be things of like, yeah, like it's about me learning how to be more comfortable with like my desires and needs, or it may be more about like, how do I navigate maybe some negative feedback or responses I'm getting from people in my life who are vanilla and who don't understand this. And so basically being aware of all of these things can better help us help our patients.
I love that so much, and I especially love that because, uh, I feel like clients often, perceive negative, um, perceptions of themselves when people don't understand them, and I think
Mhm.
that what you're talking about is, like, how do we understand this?
Right. Right.
But I think that can provide a whole bunch of healing.
Oh, yeah. I think it's tremendously healing when you can just be understood. Because I think the crux of the reason I do the work that I do, particularly people who are othered in various ways, like not just in the BDSM kink or leather communities, but for people who are in other ways stigmatized, minoritized, oppressed, is it comes from a place of like, it hurts for people to basically say that like your existence is disgusting or an abomination, or that there's something inherently bad or wrong about you. I know I've experienced that in various ways in my life, and I, know that so many other people have, and it hurts. And it does, like, as we're building on more research, for example, with like the impacts of racism or the impacts of like various forms of queer phobia, is that we become aware that it's not just this like, oh, difference of opinion or belief system or people being mean, but it does have deleterious effects on one's mental health when people basically not only misunderstand you but express like hatred or disgust or prejudice towards you. And so I think it's important for us not to underestimate that, because I think one of the things that we can look at with the research literature, but also anecdotal evidence, particularly when it comes to members of the BSM, kink, and leather communities, is that folks do face stigma. I mean, folks have lost their jobs. If folks are in court cases, especially custody cases, they've had that used against them. And so it's really important that we understand that it's not just some like, oh, idle thing. Like, it's getting into people's like very identities and lives, and so it's important that we appreciate that.
Yeah, I cannot think about a more impactful situation than when parents are considering how these things might be used against them in their private, personal spaces, but then being used against them in their natural lives. What does this look like as they're parenting and as they're working?
Hmm.
So I really appreciate that perspective. Um, so I love to do these videos, but also I'm definitely taking this training. So so I cannot wait for it, and I am just so looking forward to um, really sharing. So just so that you're aware, there was this recent post in our local group where people were talking about like, what does this look like? And I said, oh, we're about to do a training, and somebody in the group said, what is any of that? And I was so grateful for the question. I was so grateful that somebody said,
Exactly.
right? Because I think that we are failing if we are not curious.
Right. And I think,
So,
yeah, also we should keep in mind that when it comes to like clinicians of all stripes, right? Doesn't matter what your degree level is. A lot of us don't receive any training about sex in graduate school, period. Like at
sex,
all. Yeah, like, yeah, sex.
birthing people,
Yeah.
anything that has to do with women. I
Reproductive
mm,
issues or
mm,
functioning, like we don't receive that. And
yeah,
so that's just a broad scale. But then if you go into like any of the kind of subcategories of like sex, reproductive issues, birth, pregnancy, there's even less of that training out there. And
yeah,
so, and I think also too, I mean, if we're going to be honest, there can be that kind of shame of not knowing, of worry of judgment, worry of people being like, how do you not know this? Or like, you should just know through osmosis,
yeah.
through that. But, I think that is important for people to just be like, yeah, I don't know any of that. Or maybe I've heard about it in passing. But like, if you ask me to define these terms or to get into the nuts and bolts of like what that actually looks like in real life, I have no idea and I'm completely lost. And that's the kind of people I want to work with in this training. Like, I'm really excited about that, to provide like that kind of safe, nerdy space for people to ask
Yeah.
questions, talk about these things. Um, because if you ask most people about like what do you know about BDSM or kink, it's usually going to be misinformation that they have garnered either from film, television, fan fiction. Hey, shout out to my fanfic girlies out there. Um, or from pornography and erotica. But
Right,
when people
right.
are like, okay, I've heard about this, maybe it's even been like titillating and intriguing, but like I don't
Mm,
know what this is really. Like I don't know
right.
what people do. That's why I think it's important for people to get. And also, again, when we look at like ethics codes, professional conduct expectations, legal expectations, it's important for us to have the competence through training or through,
Mhm.
supervised clinical experience, or through continuing education to be able to work with these populations, right? So I think it's important for people to not be stopped by the fear of like, oh, I don't know. And what if people, judge me and come out of the woodworks with pointing fingers saying, how did you not know this?
Yeah, I love that I feel like we create this space and we're very like intentional in it to say, we recognize that if you don't know something, you're coming here to learn something.
Right.
And so sometimes that can be lost. So I do feel like there's a little bit of blame
Mhm.
explaining stuff on social like media. But I so when I'm thinking back to that comment on social media, I love that somebody was just like, what is going on?
Right.
And we're opening to like having that response.
Right. Yeah. And being able to say, like, yeah, I have no idea what BDSM and kink are. Like, that, those are a lot of acronyms. Like, what is that? Or, like, I don't know what kink is. I don't know what leather is. And how, what's the difference between these things? How do they
Mhm.
overlap? And I think that to me is just an exciting space to be in as an instructor,
Yeah.
is to be able to provide that information, because I love being able to learn things and I love being able to share what I know with other people. But I also love being able, I guess, to provide a space I think often a lot of us haven't had. I think a lot of us have been in any kind of educational space, whether it's been in a formal training program or a continuing education space, where a number of us feel like we have to stay quiet because there is blame splaining, which that's the first time I heard that term today, but it's perfect. Like, it's
Just
a
made it
perfect,
up. Woo!
ah, trademark. But it's the first time, like, but I think it's a perfect way of explaining that, because I think that's kind of one of the things that we all have experienced but we don't talk about, is that sense of like, I had a question because I wanted to know, but then I was, kind of scorned because of that,
Oh,
or people, kind of gave me the stink face because I didn't know what that meant. But when you think about our field, there are so many different topics, so many different areas of specialization for us to focus on. It's impossible for us to have, you know, peak knowledge on everything. Um, and to that point with this, I think, like, it's more about, like, if you find something, you're like, oh, this is something that I notice is coming in my clinical practice a lot, and so I realize I have to be more aware of it, or it's just something that fascinates me and I just want to know that, like, that's perfectly fine. And so I'm really passionate about this being a space where everybody can ask questions, everybody can, like, work over case examples,
mm.
everybody can be interactive, rather than feeling like, oh, like, I feel embarrassed and ashamed and I'm not gonna say anything. So
Yeah, I think that there's this really important space where I would love. So one of the things that I um, talk about a lot is what does it look like to have continuous consultation, which I absolutely do, and continuous supervision, which I think that
mm,
everyone should do. So I think that to be able to ask the question, like, I'm sorry, what is that? And what should I be reading?
mhm,
Uh, what should I be watching? I think that that is like such a rich environment
yeah.
to learn.
Yeah, no, because I definitely think, like, as I mentioned before, with like this kink and, clinical practice 101 course, it is like entry level. If you're completely green and you're like, what is any of this, as you mentioned, like, that's the purpose of this course. For people who are like, I have no idea what this really is, but I want to learn. But definitely a part of it is understanding, like, the education is ongoing. And it's not just from a, let me get scholarly sources related to how to clinically interface with these populations, but, like, let me learn more about, like, the educators from these communities, because there are, like, BDSM, kink, and leather educators who are doing work to, like, go into more detail about these practices and what it's like to actually be like a practicing member of the community. But also being able to, like you said, look at, like, books, again, not just scholarly books, but books where people talk about, like, yeah, these are the things that you should know about how to respectfully and appropriately interact with people, whether it's at a play party, whether it's at a dungeon, whether it is at a kink or leather or BSM convention. And so I guess I would again invite people to look at this of, like, it's ongoing education where you not only learn about it from a, what do I need to know when it comes to my practice perspective, but also what do I need to know about the people in these communities.
I love that so much because as I'm thinking about how you're describing that, I'm thinking about being like this continuous learner. And when people are not asking those questions, I'm like, I'm sorry, where are we going and do I bring cupcakes?
Mhm.
So so I just love the fact that it's so open and that we can continue to um, bring clinicians to the next level.
Mhm.
Maybe we don't know about all of the things, and let's be humble about that. And also, we can learn about those things. So I'm so excited that your training is coming to Touchstone and is bringing this knowledge that, frankly, not a lot of us know about. There are there are acronyms that you use where I'm just like,
You're
people
like secretly off the
translate.
side going there. Yeah, but
Mhm.
yeah, to that point, like with BDSM, it stands for bondage and discipline, domination and submission, and sadism and masochism. And, in general, that has to do with specified, distinct power and relational dynamics. And then, like, when it comes to kink, the way that I like to describe kink is as like niche, obscure, and or unconventional uh, sexual practices and behaviors that people engage in. And leather, like, which is connected to BDSM, but also is connected to kink, really emanated around like the mid part of the 20th century. Initially it was like predominantly filled with like gay cis men, but also has spread to people of like other genders. And basically it's people who experience this sense of like, you know sexual arousal and or satisfaction from wearing leather, from engaging in various kinks in leather. And so yeah, like those were kind of like the overviews of all of that. There's obviously more nuance and detail to each of those categories, but as a general sum, because thank you, that's a good reminder. And that's another reason why I want to do this, because I think sometimes people can just throw out those terms and be like, well, you know what that means, right? And people are like, mm-mm.
I love that so much. In the humble way that when something is not my specialty, I am thinking, wow, there is so much that I don't know, and also so much that can be introduced into my practice.
Right.
So I want to say I am expressing an incredible amount of gratitude to you, Dr. Holmes, and I cannot wait for this training to come to Touchstone. Um, so I'm sure that we're going to be seeing a lot more of you very
Yes.
shortly.
Yes, no, thank you. I'm honored to be doing this training with Touchstone. This is just such a wonderful group of people who are doing such wonderful work. So it's an honor. And I mean, every stage of creating this has been nothing but wonderful. And I've been so excited.
Oh, I'm psyched. I'm psyched. Thank you so much. Thank you for sipping your tea with
Yeah.
Touchstone, and we'll touch base with you soon.
Yes, pinkies up.